Hello, everyone, to this edition of the Bulletin Brief, and we're reviewing the August edition of the Bulletin of the American College of Surgeons, in which the Resident Associate Society really highlighted advocacy. And with us today, we have two of the authors of one of the manuscripts, Dr. Rubalcava, who is from Creighton University, Phoenix campus, general surgery resident there, and Dr. Smelser, who's a clinical instructor at Vanderbilt, and also a Society of Urologic Oncology fellow. So thank you both for joining us today. And really the manuscript that we're going to talk about is about how societies are involved in advocacy and how individuals can get involved in advocacy. So I'm really looking forward to our discussion today.
Well, thank you for having us. I'll yield to Nate first because, he authored some of the first sections of the paper, but maybe he could give us a little bit of background about, the history of the role of surgical societies in affecting and shaping policy and advocacy.
Thank you for having me, Dr. Mammen. When we were first thinking about the topic for this article, the idea of surgical societies and the role of a surgeon in advocacy almost was natural. As surgeons of all different fields, we focus on the high quality, high value care for our patients, mostly in the OR and in the hospital. But what we quickly found is that as we step outside the hospital, surgical societies have really allowed us to continue that quality of care for our patients and for our profession as a whole through advocacy. Over the past 150 years in which surgical societies, at least here in America, have existed, they initially started, the American College actually started as a forum for disseminating education and teaching techniques and how to care for different complications. But as they developed and as they evolved, they too saw that no one size fits all, that in order to provide the best quality care for all of our patients, we have to come together collectively to make our voices heard.
What I thought was really interesting, and you kind of alluded to this, is kind of the long history of the surgical societies and their involvement in advocacy of various types. And even though there are different surgical societies and maybe different specialties, though the American College of Surgeons encompasses all of them, even the individual surgical societies kind of came to the same conclusion that advocacy was incredibly important. And it was also interesting, I found in the article, that all of them, or at least several of them, set up political action committees as well. The Surgeons Pact, for example, for American College of Surgeons, but some of the specialty societies did as well. Could you comment a little bit about kind of the PACs and what their purpose was, or purpose is, I should say?
Sure. So political action committees, PACs, and specifically the American College of Surgeons Pact, are designed to help shed light on important issues, both in the surgical profession and our patients, and bring them to light to legislatures.
So, Dr. Smelser, I wanted to explore with you a little bit more about some of the present policy activities that surgical societies are doing. Could you comment on some of those activities that are presently very relevant and being worked on by various surgical societies?
Absolutely. And, as Nate said, the purpose of PACs is to elevate issues that originate with the patient to legislators, and not only at the national level, which obviously is where a lot of health policy gets made, but also at the state and local level. There are many initiatives that have started through discussions at local chapters of the American College of Surgeons or another surgical society. Regarding current initiatives, there were a couple that we highlighted within our article, and there's one that I think is very relevant right now, and that's related to the COVID-19 pandemic. And there's sort of two issues that I think that surgical societies have advocated for. The first is that because of delays in screening or access to cancer care, something obviously Dr. Mammen, you and I both deal with, there has been a significant number of patients who have missed screening visits for things like colorectal, skin cancer, prostate cancer due to the COVID-19 pandemic. And so specifically the Commission on Cancer, which is a very important subcommittee within the umbrella of the American College of Surgeons, is advocating to ensure that patients are able to get back to a regular screening schedule. And I don't know about in your practice, but I feel like over the last 6 to 12 months, as some people have started to come back to visit regular appointments, we've almost seen a stage migration for some common cancers because there were so many patients who did not get care in a timely manner in 2020. And that certainly spilled over into 2021. And with the current COVID numbers may even spill into 2022. So critical issue that surgical societies are able to elevate to the attention of legislators to address that policy shortfall. A second area where I think it's worth mentioning or highlighting is changes in the way in which care is delivered to patient. And one, I think, beneficial but unanticipated outcome of the COVID-19 pandemic is that there was a humongous increase in the utilization of telehealth. And telemedicine has long been a way in which we thought we could potentially deliver care even to surgical patients, but it's not been something that payers have supported. And so it's really sort of been dead from a policy standpoint. But because of issues with access, like we sort of talked about with screening and et cetera, payers, including Centers for Medicare, allowed telehealth. And that was a direct result of the action of lobbying by organizations like the American College of Surgeons. And that's ensured that the thousands, even millions of patients nationwide can get timely care. And we actually looked at some data amongst urologists, which is my specialty, and it showed that in the first 6 months of the COVID-19 pandemic, about 43% of urologists transitioned to using telehealth on a weekly basis. So I think that shows that surgeons are adaptable, and if they do have a way in which to approach these changes to their practice through useful policy initiatives, it helps us deliver care to patients in a smoother manner.
I think those are fantastic examples of kind of initiatives that are really important and really timely, of course, because I think they're both related to the pandemic. And I think that they both provide opportunities as well, at least especially telehealth, which is hopefully an opportunity that we can capitalize on. Not that I would say there's much that's come good that's come from the pandemic, but perhaps that's one where, especially in areas that are more rural, where we are now going to be able to provide access to individuals that otherwise wouldn't have had easy access to specialists or even basic services. So certainly, I think continuing to advocate for being able to allow individuals to access telehealth even after the pandemic will continue to be really important. And I like the example about what percentage of urologists are already transitioning to telehealth, something that we were all pretty reluctant to do. But now I think that a lot of us have a hard time imagining not having telehealth anymore.
I agree. And I think another interesting finding in that area is that actually a plurality of patients find it to be an acceptable way for care to be delivered. And even we have some preference for things like low-risk surveillance and follow-up, in which maybe a routine lab that can be drawn locally is the only thing, like PSA in this case of prostate cancer, is the only thing that needs to be reviewed. And so it can save a lot of trouble in terms of travel and expense. So exciting initiatives. And the key is that they are grassroots initiatives that come directly from surgeons taking care of patients.
Sure. That's a great point. I want to transition to kind of another important topic, and Dr. Rubalcava, if you could kind of address this, which is, there are all these important topics that need to be dealt for the benefit for our patients, telehealth, or making sure that we have access to screening for individuals who may have fallen behind, and a lot of policy initiatives associated with this as well. How do individuals who are still in training get involved? Obviously you're incredibly busy learning as much as you can. Most individuals don't work 80 hours, but residents often do. And with that, there's, really limited time to be able to do many of the other things that you might want to do, including advocacy. So how have you found ways to be involved in advocacy, and what we just discussed for other trainees?
You bring up an excellent point, and I want to first start off by saying that myself included a couple of years ago, thought that, I don't have time for advocacy or policy or anything like that. It's just, I don't know what it's about. I don't know where to get started. And the same response when I talk to co-residents from different institutions. And the one thing that I want to emphasize is that the American College of Surgeons really has simplified the process, so where if you're like, I don't have any time at all to be involved in this, then you can contribute, donate to the Surgeons PAC, be it $25, $50, whatever you got, it certainly helps. But then for those who have a little bit more time, there's the Surgeons Voice Advocacy Center, the website, and, it really highlights the different policy issues that are currently going on, both at the state and national level. The college has set up these emails that you can send to your representatives, to your legislatures. It takes less than 5 minutes to fill out, if that, you just sort of pick between the different issues that are important to you and or your patients and send those emails. And then for those who maybe have a little bit more time or are more passionate about it, there's the annual Leadership and Advocacy Summit in Washington, D.C., where you can get face-to-face with the legislators on Capitol Hill, meet future leaders of the American College of Surgeons and colleagues. And then if you have a specific interest or passion that you have identified in your community, in your hospital, there are toolkits on the website for simplifying the process to get those issues heard and off the ground in a meaningful way.
Yeah, a tremendous amount of resources, and as you alluded to, Dr. Rubalcava, it's really, they've tried to make it as easy as possible for us so that we have to do the least possible work, particularly having those websites that are kind of have those ready-made template type letters ready to go. So yeah, no, thanks for pointing those out. Dr. Smelser, are there resources that you found to be useful as you've continued your advocacy journey?
Well, first, I have to agree with Dr. Rubalcava. I mean, the Leadership and Advocacy Summit is probably one of the most high yield, 2 to 3 day experiences for any stage of the surgical career to onboard into advocacy. You get in-depth training from great speakers and experts on leadership and advocacy, and then you put it to practice, as he said, and go to Capitol Hill and speak with your elected representatives from your home districts. And those people listen to surgeons, and they listen to the American College of Surgeons because we've been reliable advocates for our patients for 100 plus years. So I have to agree that that's one of the highest yield ways to onboard. But I think I would also point out that regardless of where you are in your career, the college has an outlet for you. If you're a pre-medical student or a med student, they have ways to get involved in advocacy. If you're a resident or associate, early couple of years of training or practice before you become a fellow of the American College of Surgeons, or even if you're a senior surgeon who may even be, partly retired or retired in sort of an emeritus setting, they have ways in which you can get involved. And from a pragmatic way for residents and fellows and early career folks, there are 4 standing committees that have monthly conference calls. And the Advocacy Committee meets on Wednesdays at 9 p.m. Eastern, one Wednesday a month. And so there's information on the American College of Surgeons website on how to call in on those calls and get involved. And they're not intimidating, even if you've never called in before. You just introduce yourself or maybe listen. But that's really the way to find out the most up-to-date and sort of cutting-edge opportunities.
Well, I really do appreciate you kind of mentioning the committee structure that allows kind of really to have no barriers for participation. Anyone can join and get involved right away. And I really appreciate you highlighting that because I think often folks think that you have to know somebody or you have to be invited in some special way, but really that's fantastic how open the invitation is for anyone who wants to get involved to be able to be involved right away. Well, I think this article was, chock full of great information. And I know we've covered a few of those details, but Dr. Rubalcava, anything that you wanted to highlight that we maybe haven't covered yet?
My take-home message really is for the trainees, medical students, residents, fellows, and it's that it's never too early to get involved in advocacy. The caring of our patients doesn't stop in the OR, doesn't stop at the end of the clinic or when we get done with having a manuscript accepted. It continues outside the hospital, and really the best way that we collectively as a profession can ensure that our patients continue to be taken care of in the future and now is by getting involved however much you can.
Dr. Smelser, anything that you'd like to add as something we didn't cover in the article or something that you wanted to highlight?
I think one thing that I would also highlight is that, we've talked a lot about larger policy specific for patients, but another role that surgical societies have is to address public health issues. And I think one of the better, more relevant and contemporary examples is the Stop the Bleed campaign, which has a goal within the Committee on Trauma and the American College of Surgeons to be as common and ubiquitous out in society as CPR. And the goal, if you're not familiar with Stop the Bleed, is to learn hemorrhage control, partially in response to the increase in gun violence in the United States, but also just because hemorrhage is a preventable cause of death. And so the goal of the program is to take bystanders and turn them into active participants in addressing a public health crisis. And so I think that just highlights one area where surgical societies had expertise on how to address a specific problem, put together a very easy, scalable, and I think approachable program, and are now disseminating it out in the community. And more than 1 million people have taken the Stop the Bleed course at this point. So I think that just shows that if there's a public health issue that needs to be addressed, surgeons are at the ready through organizations like ACS to address it.
Yeah, thank you very much for highlighting that program, Dr. Smelser. I do think that's an incredibly important initiative and something that is a very concrete contribution the American College of Surgeons has provided, as well as surgeons as a community. Well, first of all, thank you both for your time, and I really appreciate it. And secondly, thank you for writing such an excellent manuscript. And for those of you who are listening, certainly take some time to review it within the Bulletin, the August issue. And thank you again for listening to us today.